Are you guys ready for us? Okay, go ahead and get started then. Okay, well thank you everyone who is joining us today for the vaccine information session at Arcadia High School. We're looking forward to providing some information and answering your questions. And thanks for everyone who's joining live as well. If you do have questions, just send us a message on Facebook and I'll make sure to get that answered tonight. So tonight we have Dr. Hodes from Mayo Clinic in Arcadia to provide some information for you, talk through some frequently asked questions, and then answer your questions that you have. So looking forward to hearing from him tonight, and stay tuned at the end for how to sign up for the vaccine.
Thanks for inviting me, and it's a pleasure to be here. I was going to give a little background on the vaccines that we're using and that you might be reading about and hearing about, and then also running through some commonly asked questions and giving some simple answers. And if you have any questions beyond that, I'd love to hear them and try to answer them. So yes, I'm a family practice doctor working here in Arcadia, and I've seen a lot of COVID and a lot of people getting over COVID symptoms long after the infection has been resolved. So I wouldn't say I'm an expert, but I do read a lot of the material, that normal people also do read, and it's interesting and evolving and kind of complicated at times. But before we get to the slideshow and the fun, colorful pictures, I do want to do a little bit of a kind of a biochemistry review. And this is important. So, we have DNA, we have RNA. These are two different things. DNA is very sturdy, and it persists in our body, in every cell of our body, for our whole life, from the time we're born until we die. Half of it comes from your mother, half of it comes from your father. DNA is like the pilot in the ship that runs things. It directs what proteins and sugars and other things are made and what functions happen in our bodies. RNA, that you sometimes hear about, is a messenger type of molecule. And inside the cells, DNA directs the production of messenger RNA. And the messenger RNA swims throughout the cell and is actually like the sailors in the ship doing the work for the pilot. The mRNA doesn't last very long. It doesn't last forever like the DNA does. And it breaks down, dissolves, gets reconstituted into messenger RNA again to do other tasks. Viruses do not have DNA. They only have RNA. So almost by definition, even though viruses come in all sizes and shapes, almost by definition, a virus really is not built to last. It needs to get into a host, attach to cells of that host, and enter into the cell to kind of, to reproduce and to kind of hijack the function of a living cell. So all viruses do this. Some are really successful at it, some are poor. And so I think that's what I wanted to say about that. So this is the first picture. You recognize that big red blob. It's kind of sinister looking. Everybody knows that's COVID. And it's kind of a medium-sized virus as viruses go. It's got these spiky things on the surface, and those are important. Those are proteins, and those proteins are what attach to cell membranes, and we mostly think of muscle cell membranes. And when they attach to the cell membrane, they can shoot the messenger RNA into the interior of the human cell. And then they hijack the function, and you get reproduction of viruses from that. Oops. That if you didn't have that spike, there would be no recognition, and there would be no entry of the virus messenger RNA into our cells. So, what would be a great strategy for blocking the infection of this virus? Of course, it would be to smother that spike protein on the COVID virus with antibodies. So, anybody who's trying to invent a vaccine against this particular virus, they have to figure out a way for our bodies to match up and attach to and effectively smother the spike protein. So if a person such as me gets a whiff of COVID and now there's COVID in my body, if I have antibodies to the spike virus of the COVID virus, the spike protein of the COVID virus, that virus won't have a chance to reproduce and cause me any trouble, and I can go on my merry way. There's three different ways you can kind of think of for these companies worldwide that are making these vaccines. The first one would be to create, sort of out of the blue, the protein that makes up a large part of the spike protein that occurs naturally in the COVID virus, and then introduce that into the body, and the body would create antibodies against that protein. Okay. I don't know if anybody was doing that actually. But the second one would be to create the protein that is made up of the spike protein and introduce that into a very benign virus, like a cold virus. Adenovirus is the one that's mostly used. And this has been done in a lot of other vaccinations. I can't really list them, but it's a common approach, because then once you insert that the protein into the interior of the virus, the virus is pretty good at swimming along and entering into the body, and then kind of inciting or stimulating an immune reaction. Now you get antibodies to the spike protein. Actually, the AstraZeneca and Johnson & Johnson does that, exactly that method. A third method is to create the actual mRNA, and you can, it's possible in the laboratory to do that, but how would you get the mRNA? It can't just go flying out in the blood. You need it to get it into the cells. So you can dunk it into like a little droplet of oil, if you could kind of think about that. And it sort of is swimming around and just dissolved in that oil, and that oil is able to then mesh with a cell membrane wall, and the mRNA is able to enter the cell, and that incites the antibody response. So then the body will create antibodies to the spike, or the mRNA will direct the development of antibodies. So I hope that's reasonably clear. It gets a little complicated at times. A lot of people ask, like, well, what is in these vaccines? And one thing I can tell you is, I couldn't tell you. I mean, it's actually all around. This is kind of this is a chemist's world, but basically it's an oil and sugar mixture, and in that the mRNA is dissolved, and that's a very good vehicle for bringing the vaccine into the body where it can attach to cell walls, and then the whole process follows from that. The Moderna is, so the Moderna is very similar, and there are some differences in it, but it's remarkably similar. And even though they kind of came up with two different processes, this may seem like very science fiction, like how do you create mRNA, but it's actually been done, and we have like the shingles vaccine. It's been around maybe 5 years. This is their method too, and like these two, which are commonly being used in our community and elsewhere in the U.S. and elsewhere in the world, they do tend to create a really robust reaction, which is good. It means a lot of antibodies are being created, and that's what we need. That's our defensive police force, immunologically speaking. But they do tend to, if people get reactions, it's because you're getting a really strong reaction, and a lot of antibodies are being formed by this method. Okay, so there are advantages and disadvantages of each vaccine. The protein-based one, yeah, I don't know how, if anybody's actually doing this. I haven't really read about this, but this would be direct protein, creating the direct protein. It's been used for other vaccines in the past. It's really easy to store and administer. It tends to be slow, and it needs an adjuvant, which I'm not to boost the immune response, because it's a little bit lazy response. The viral vector, and that's sort of like the Johnson & Johnson is the one that we're using around Wisconsin and Minnesota. It does not require an adjuvant, so that means you can get a direct and reliable response to it. And it is reliable. You only need actually one dose because it does tend to incite a really strong response. And then if you look at the Pfizer Moderna, that is the direct messenger RNA that stimulates the virus from not being able to replicate because you're smothering the spike virus. And you do need a second booster shot on that one. And it also, especially the Pfizer, has presenting some difficulty with storage because it has to be stored in super freezers, which are not generally available everywhere. So the history of these, both the Pfizer and Moderna, Pfizer first was granted authorization and it was put on a fast track. It doesn't mean that they were cutting corners in terms of the science. It just means that there were some kind of legal padding that was, or guardrails that were put up so that they were not being held to the usual constraints that vaccine manufacturers are in terms of if there are any reactions. Fortunately, there really have not been serious reactions on any kind of large scale, so that has worked out, but it really expedited the availability and the distribution of these vaccines. And probably that also cut a lot of costs, but it is important to know that they didn't just take shortcuts in terms of the science, So and then the things I mentioned is the Pfizer needs to be really refrigerated in very cold conditions. The usual thing is to give 2 shots 3 weeks apart, and it's actually authorized for kids above 16. And that doesn't mean that it's dangerous for a 15-year-old. It just means that they didn't do the testing for it, so it wasn't authorized. So in the future, it probably will be. It's probably how that will go as they do further investigation. And then Moderna is also an mRNA vaccine, and it also in December was granted emergency use. It does not need to be stored in such cold conditions. It's just sort of a routine freezer works pretty well for that. And that one is okay for people over 18. Again, the same thing, that just happens to be what they first set out, and then they did the safety research on that, and that's what the data supports, but probably in the future that will be amended. Okay, does it matter if I get the Pfizer or Moderna vaccine? These are some common questions. It does not. Both of them are equally effective or very closely effective in giving immunity, and it's over 90% for both of them. And also, that's good, because the fact is you usually can't decide, you usually cannot dictate that you want to have one or the other. A lot of it depends on the availability of these vaccines, and my advice to patients is usually take what's available, because for my purposes they're pretty equivalent. Possible side effects, well, okay, the blue is the first shot, the orange is the second shot. As you can see, the second shot is the one that usually people get reactions to if they're gonna. These are usually not very serious reactions. They are very often injection site, which anybody who's had any shot, tetanus shot or anything, knows sometimes it's a little sore on the spot where you got the shot. That happens. Usually goes away after a day or two. You can certainly get a fever, chills, achiness, like kind of flu-like symptoms, especially in the first day or two, usually the first day, and usually the second shot. And the reason the second shot does tend to be associated with those a little bit more severe effects of the vaccine is that you already have immunity. And so your body is a little more exaggerated in reacting to that, and it's not a danger to you. What is a danger to you is COVID infection. So I think most people just handle it, and I usually recommend that if they're having those symptoms, that night, take an Advil. It's not really recommended to take an Advil before, but for symptoms like fever or chills or night sweats or something like that, or achiness, Advil does not attenuate the effectiveness of these agents. Okay, and if I, oh yeah, this is a good one. If I, as long as we're, yes, so actually serious side effect to any vaccine is anaphylaxis, where you can't breathe. Okay, that would be a serious thing, and I would recommend no repeat of the second shot. Anything short of that is acceptable. And it is true that the 95% efficacy of these vaccines, which is amazing, which is really a really high level of effectiveness, but it is only attained when you get the shot and then an interval and then the booster. And yeah, so some people don't get a reaction, and then they're, I don't know, kind of strangely disappointed. Like they think maybe it wasn't effective, or it didn't create any antibodies. But when we look at some people and see, do they have antibodies, actually whether somebody had a reaction or not, it doesn't matter, they both have antibodies. So if you're one of the lucky people who gets no reaction at all, you can still be rest assured that you're a lucky person, because you can get any reaction. Can I get COVID from the vaccine? You cannot, because you're not getting injected with the virus, only the mRNA, which sort of deteriorates. Okay. If I've had COVID-19, should you be vaccinated? And we're saying yes, but we're waiting 3 months. So And you kind of think like, well, why do I need to get a vaccine if I already have the disease? Like, don't I already have antibodies? But how it works is when you get an infection like this, your body produces a huge swarm of antibodies. Some are directed at the spike, some are directed at other proteins associated with the virus. So only a small fraction of the antibodies that your body produces to run off the actual infection are going to be neutralizing and effective for preventing a new infection with COVID. Whereas the vaccines are very targeted at the spike proteins, and like 100% of the antibodies that are produced with the vaccine is going to be targeted directly at the neutralizing proteins on the virus. So that can give you lasting immunity. I don't know how long lasting, but effective immunity. And is it safer to get a COVID vaccine versus actual COVID-19? It is definitely much safer to get the vaccine than to get the infection. Vaccination means you're less likely to spread the virus. This is just if you prevent the infection. The side effects of the vaccine are mild, except with people with COVID-19 can become severe, and people that with COVID-19 can become severely ill, and some will die. And severely ill, and honestly, as a doctor, some of these things are lasting, and some of them are really unknown. We really don't even know, maybe for years, what other side effects of the infection are going to be. Oh yeah, it says it there. We do not know the long-term consequences of COVID-19 for organs, because it really goes into a lot of different organs, including the brain and blood vessels, lungs, obviously, and what damage it does, we are not entirely sure yet. And I have a lot of allergies, including food allergies. Should I receive the vaccine? Yes, you should. And those with a history of allergic reactions should be observed for 30 minutes. Usually what we do is do the vaccine and wait 15 minutes just to see if somebody has a reaction. That's just kind of a standard protocol. But if you're somebody with really suffering from a lot of allergies, you might feel safer just to hang around long enough sort of in the facility just to make sure that nothing untoward happens. It's not likely. And then if you're pregnant or breastfeeding, can you receive the vaccine? Yes, you can. There are not any significant studies in this, but it's being widely done. And so sometimes these things are done retrospectively, meaning a practice is being rolled out and becoming a standard, and then later epidemiologists and statisticians come back and say, were there any problems associated with pregnancy or breastfeeding and this vaccine? And we learn later whether there were any problems, but we have eyes and we're not really observing that, and it's pretty widely done now. Can people with autoimmune conditions or immunosuppression, like cancer treatments, get the vaccine? Yes, actually, that some of those people are at very high risk for developing complications of COVID infection, so we want to block COVID infection. The only question about this when people talk about it is whether somebody who might be getting chemotherapy or has immune compromise, whether that person would have a really strong antibody response. So that I don't think anything has been written on, but just kind of common sense, I would think like maybe their reaction or their positive response to the vaccine might not be as strong as somebody maybe a little younger or more healthy. And can people with a history of Guillain-Barre be vaccinated? The Guillain-Barre is a serious reaction to vaccines that people have. It's maybe 1 in a million, it's not very common. But the literature on this, it's gotten a lot of attention, is that it is safe, and that's been my experience as well. Does vaccine cause infertility? No. Will the vaccine change my DNA or genetics? No. Because this is why I kind of started with this thing about DNA, RNA. These are two totally different entities. So there's no DNA involved in the vaccines. It's messenger RNA, which is created to be fragile and short-lived. So it's not gonna like invade your DNA and change your personality. Okay, I have heard that I should not have my mammogram shortly after a COVID vaccine. Is that true? Actually, it is true. And that's because if you get a vaccine in your arm, one of the body's immune responses is the lymph nodes can swell up, which is part of your normal immune response. And you get a mammogram done, and they don't know, they don't read the history, they're just looking at anything that's unusual. And lymph nodes is one of the things that they look at. So it could be falsely believed by a radiologist that the lymph nodes are indicative of some kind of a breast cancer. So we usually say to wait about 6 weeks. And okay, that's all explained. Is it safe to use fever-reducing pain medications like ibuprofen and Tylenol before or after receiving? They don't like us to use it before, and I would say if you are having symptoms that are uncomfortable afterwards, especially it usually is not until nighttime anyway, then I think it's fine to do that. Most people say that. Will I need a booster dose of the vaccine? We don't know. Just don't know because it hasn't really been around a year. It's only been around these have only been around for a few months. But that will be a very important question. And I think that one thing to know is that your immune system is very smart, and first you have antibodies floating around, but even if you have unmeasurable antibodies, you still have other cells in your body, B cells they're called, and these B cells have memory. And that means with a lot of diseases, you might have undetectable antibodies for a disease, but the exposure to the virus is recognized by the B cell, B like boy, floating around, and they stimulate a reaction. So you have layers of immunity that helps protect us. Okay, once I get my COVID vaccine, do I still need to wear a face mask? We're saying yes, because we actually don't know whether somebody, even if I have a vaccine, 2 vaccines, and I'm not going to get infected, I can still get exposed. If someone sneezes on me at the Randy's or something, no, they won't because they have masks there applied. If I can be a carrier potentially, even though I don't have the disease. And I think we're shooting for 70 to 80% immunity before you really tamp down the prevalence of the virus in the communities. Oh, okay, can someone who is vaccinated still spread COVID-19? Yeah, that's what I just kind of said there. Questions. We've come to an end. How do you want to do that? Okay. All right.
Okay, so one question I have is it possible to to get a microchip in the vaccine?
Yeah, I've heard that one. Nope, because it's, I just would say no. No. I actually do hear these are you know, people get scared about stuff like this, and I've heard a lot of different speculations, and they include things like, well, will it make me infertile? No, that's not been recorded. And this is we kind of base our conclusions, or at least our speculations and our opinions on our experience. That's really powerful. And sometimes it's somebody speaking to us who we work with, or a family member. It's often not, sort of, and sometimes it can be the internet, but actually a family member or a coworker is really powerful. Kind of sticks with us and gets under our skin, and we think about it a lot. And so you do hear some things, that it can be a control, like a microchip or something like that. And there's not really any evidence for that. There's no evidence for that. And then will it cause you to leave the clinic in a wheelchair? Heard that one. And a lot of these things would be are kind of people to wonder about. But the thing is, these vaccines are being tried. I mean, it's not like a whole new. A lot of times we think like, I'm not going to be the guinea pig, but these millions of them have been used throughout the world, and it's not just Wisconsin, and not just Trempealeau County. It's throughout the whole country, and we're getting very good safety measures on these things. In general, vaccines do tend to be safe versus some medications, which are, it takes a long time to, I think the bar is a little lower for blood pressure medicine, for instance, than a vaccine, because the vaccine is preventative, and it should be lower. And when you're giving vaccines to people, they don't have any disease, you're trying to prevent it. And maybe you might not feel that, you might feel a little bit less risk averse with an antibiotic, for instance. So I generally feel I'm definitely a strong vaccine advocate, for sure. And in this case, I think that patience on the part of people and adherence to the things that we've been doing with the masking and being careful and thoughtful about being involved in gatherings. I don't think it's going to, I'm hopeful it's not going to go on forever. I'm not thrilled with wearing a mask all the time. But the number one thing is to get to a level of herd immunity, and you can wait, several years for people to get the natural disease, but we're going to be losing a lot of people in the process, and having a lot of illness in the process. And it's ugly. And it's, when it kind of outstrips the capacity of hospitals and healthcare services, some places right now in India and Brazil, and these are really bad situations. So, I think we're fortunate. Trempealeau County has done a super duper job, thanks to the health department and other entities. And so I'm really happy about that. And, the sooner we kind of get to that 70–80%, it just gives the virus fewer people to go to, and it sort of peters out. And that's how viruses are. I mean, it's not a new behavior. Of course, the COVID is just a really good virus because it's really contagious. It's respiratory borne, so all you have to do is talk, and it spreads. And it's mild in a lot of people, so a whole bunch of people can catch it and not know. And it's just like, I don't think it means to kill its host, but it happens. And if enough people are infected, it happens a lot. And 600,000 people in this country only, it's a lot. And a lot of people have also been injured by it. It's a lot. And so it's a really effective, it's a really successful virus that way. We haven't really seen that with many other viruses. We're always getting, I mean, the world is always inventing new viruses, so it's an interesting thing, but some things like Ebola would never be able to do this because it kind of kills everybody. So everybody who gets it just dies. And so that's pretty scary, but it's not likely to take over the Midwest because it wouldn't be, it just wouldn't be a successful virus.
Can you talk about Johnson & Johnson a little bit?
Yeah. Yeah, that's an interesting one. I don't know what's going to happen with that. I haven't really read in the last couple of days, but that's been put on pause because of the association of it with blood clots in women of a certain age, like 18 to 45. That's been noticed. But there are also kind of conflicting or disputing views that this is actually a background phenomenon where, especially women, 18 to 45, which if you think about it is like fertility years of women, and clotting is associated with pregnancies, it's a very high risk factor for that, and even birth control pills, some small, but if you're looking at enough people, you start to detect these trends. So some researchers or people have suggested that is not too far from, I think it was like 7 million vaccines and there were like 6 cases, and they were saying like that's not too far from the natural background prevalence of blood clots of this kind. Because they were saying something like 1 in a million is about average, about normal. Like people get in that age group, I guess women in that age group are at risk, 1 in a million chance, and it's not very common, obviously. But when you scale it up to 7 million vaccines, and then you got 6 cases, it's a statistical thing. Somebody, epidemiologist or somebody smarter than me, needs to look at it and say like, okay, this is a correlation, or it's not. And so that actually needs to be done, and hopefully it can be done quickly. Because Johnson & Johnson is actually attractive to a lot of people. It's attractive to a lot of healthcare organizations, departments, because it's a one-shot thing. It's a powerful tool that way, and it would be nice if it could be exonerated on this. But if it can't be, then we shouldn't be using it. I'm hopeful, just because I do think you think about the bigger picture with public health and just the logistics of delivering vaccines to people. You'd like to make it as simple as possible. One shot is simpler than 2. So I don't know. Everybody has to just stay tuned on that one. I will. All right. Good. Well, thank you for your time.
All right. Well, thank you, Dr. Hordas, for coming tonight and sharing all of that information. I learned a lot today, so that was super helpful. I hope everyone watching got to learn something new about the vaccine. So if you are interested in getting the vaccine after tonight's session, you can visit our website and sign up for the vaccine online. That's the easiest way to do it. Otherwise, if you're having any problems or questions later on, you can also reach us by calling the health department at 715-538-2311, extension 220. Thank you, everyone. Thanks to Arcadia School District for hosting us and WTCO for helping out, and Great Rivers United Way for helping us with this program. Have a great night.